Hello, everybody. This is James. I'm the Business Partnerships Manager with AAA. Thank you for joining our webinar today. For us at AAA, we are the American Accreditation Association. We are recognized internationally by the US government to provide the accreditation worldwide. We are working in two different locations. The first one is located in the USA in Tyson Corner, Virginia State, and the other international operations office is located in London in the UK. And right now we are operating globally in 52 countries all over the world. In AAA, we are actually committed to provide uh, international accreditation that inspires confidence in the quality of products, services that you guys are providing to accept the results from the accredited organizations and the protection of health, safety, and environment of the public. And we are also promote the acceptance of the accredited results certificates internationally and amongst the global partners. We continue to strengthen our operations teams, developing the capacity and capability to exceed the expectations of our customers and stakeholders and deliver accreditation services to the highest quality and technical standards. We are working on many different types of accreditation. We are working for the international ISCWA standards for the hospitals accreditation and healthcare accreditation. We are working on the criteria of institutions and programs accreditation in the training educational providers as well. We are providing ISO 17020. We do provide for ISO 17025, 15189, 17043. And also we do provide ISO 17021, 17024, 17065. Thank you for joining this webinar today. And thank you for being a part of this webinar. And now let's start with Wendy. Wendy, go ahead.
There we go.
Hi, welcome.
Thank you. And welcome, everyone. I appreciate you attending this meeting, and happy morning, afternoon, evening, hopefully not night for many on this. So want to welcome you to our webinar today on getting ready for accreditation compliance in healthcare. And we're going to be talking about strategies to help you succeed in that. And I just want to do a little bit of housekeeping first to let you know if you have any questions, please put it in the Q&A area, try not to do the chat area. We like to keep all the questions in the Q&A so that we can attach those when we post the video to the YouTube area. And it's easy for Dima when she has to ask the questions at the end of this presentation. So we're very excited. Dima, you want to add anything for the participants?
I just want to welcome them. Hello, everyone. Thank you for attendance today, and we are looking for your participation and interaction with us. So whatever questions you have, please drop them in the question and answers section here, and we will answer all of your questions and inquiries today together. So yes, Wendy, please. The mic is yours and you have the stage.
Thank you. I'm going to turn off my camera so you can just watch the video and hear my voice. So we're going to get started. Maybe there we go. So let's take a look at what we're going to be talking about today. James was kind enough to do who is American Accreditation Association. So a thank you to James on that. Once we finish this agenda, we'll be discussing why accreditation matters, foundations of compliance readiness, the pitfalls and smart solutions, real world case studies. Just going to do a quick overview of some experiences that we've had. And then talk about some of the tools, templates. If we have time, we'll do a live demo. If not, and you want to become accredited with American Accreditation Association, we can work with business development to do live demos on the tools and templates. And then we'll have a quick question and answer and wrap up. And then everyone can have a wonderful day after that. So really, I just want to share that the goal for this webinar is to take away any anxiety that people may have about accreditation and turn things into action so that you have a pleasant experience going through an accreditation process. So one of the first things that we want to talk about, let's look at the big picture. And that accreditation really isn't just about paperwork or passing a survey on that. It's about aligning your systems with the highest global standards of care. And that's what American Accreditation Association has. It's about patient dignity, quality of care, data integrity, ethical leadership, and professional accountability.
Yes.
Sorry about
As
that. There was dinging in the background, so I needed to take care of that. I apologize. Dima, did you have something?
No, I thought there's an internet connection and I want to make sure if your camera is on or not. That's why I feel there's something here.
Yeah,
I thought,
I
okay,
appreciate that. So
okay, perfect.
really our focus is promoting best practices, increasing the trust, both with the patients, the community, as well as your staff on that. And guess what? Going through accreditation, you'll find systems and processes, and in the long run, it actually boosts your operational efficiency and the transparency. And it can attract partners as well as customers, and improves accreditation helps you speak a global language of healthcare, whether you're in Cairo, Florida, where I am, or United Kingdom, wherever you are on that. So take a moment and think about what's your organization's primary reason to pursuing accreditation. And if it's patient safety, legal compliance, competitive advantage, or partnering requirements, those are all things that we can help you with, and accreditation actually impacts all of those areas. I can share that I recently worked with the community hospital, and the medical director was very open in sharing why they wanted accreditation. And his quote was, "We want accreditation not just for prestige, but to raise our standard for care for the people we serve every day." And that's really the mindset that I hope you have when you're going after accreditation, and because that will drive success. Oh, there we go. So really there's 5 pillars of readiness. Let's break it down. It's nothing super secret, and it can be done by all on this. So let's talk about that. We're going to go into detail on each one, but here's an overview talking about leadership commitment, policy, infrastructure, workforce competency, documentation, discipline, and continuous monitoring. So let's break it down to the first one of leadership commitment. This really sets the tone. When you have a leader that believes in accreditation, that it's something that is good and not just another challenge, another piece of paperwork that you have to do, but they believe in what it's going to create, that goes a long way with how your facility, your workers, and community view accreditation, as well as how pleasant the process is for you. And so it really just sets the tone, prioritizing compliance in everywhere from the board of directors, the executive leadership, directors of the units. It's very important. And what you can do is you can make a quick link to any strategic goals that you have for your facility or organization and make those into accreditation outcomes to measure things. So accreditation is not something separate from what you're already doing. It's to enhance and to bring things together. Because through accreditation, you'll see a lot of things are measured, because we like to look at outcomes, and what gets measured and modeled gets managed. is kind of the quote that we use here. So we believe that the leadership's commitment to the strategic alignment, accreditation goes hand in hand with that alignment, culture of quality. I believe everyone that's in healthcare is there to help the patient. This just supports that and creates accreditation standards, create a way for you to observe and see all the quality work that you're doing, and having leadership engagement is key. So let's look at the second pillar of policy infrastructure. Policies guide us, and by us, I mean your facility, guide your facility to provide the best quality care and consistent care to your patients. And the policies are current, they're accessible, and staff friendly, so they're easy to understand. And you want to match your policies and any local or international standards to ensure that you're meeting all three that you're wanting to do on that. And sometimes with that, you're like, how can I do that? A simple way of doing that is doing it with crosswalks. A simple spreadsheet would do. We'll see this later on when I talk about tools, but I have created a spreadsheet for many of the organizations that I have put through accreditation of what their policies are, and then a crosswalk indicating what standards do they apply to, whether it's the American Accreditation Association standards or any local laws and regulation standards that the hospital has to follow. So it's easy, accessible, and an easy guide and reference. And I think you'll be amazed that when you start looking at your policies actually address numerous standards at one time. So it's not like you have to create a specific standard for every single standard on that. That's not what we're asking. We're asking that for American Accreditation, you create the standards that work for your hospital, and then we view where those standards are but with your guidance on that. Another thing is making sure the policies are accessible. There's a lot going on in healthcare and in your clinics and hospitals. And so if someone needs to reference how to handle something, that they have a way of looking that information up easily. We know how it is if it's word of mouth or how am I supposed to, you ask someone else how you're supposed to do something. You might be told how things were months ago or how they just think it should be done, where this allows staff to review the policies to ensure that the policy, that they're following the policy, which has been determined to be the best practice to ensure patient safety and quality of care. So the third pillar is the workforce competency. This is one of my favorite pillars on this, the workforce. I think they are the heart and soul of your care to your patients. And really, some of the things that you need to focus on when looking at accreditation is role-based training. Now, there are trainings that every single person in your hospital need to get, but there's also specific role-based trainings that need to happen, specific to the emergency room, specific to surgery, specific to the wonderful nurses at the bedside, specific to discharge planners, intake. So role-based trainings are a large part, and I can share that during some accreditations, that's where some hospitals are struggling. And because the key is they do it, but you've got to document that you're doing it and what that means on that. So another one is micro learning, continuous learning. You don't want to wait till the last minute to do an all hands on deck training of everything that needs to happen before the surveyors get there. You want to continuously incorporate learning into your systems, whether that's you do the mandatory learnings when someone's hired or brought on board, but then incorporate smaller learning segments into your staff meetings, monthly emails, the trainings they can do online, in the moment teaching on that. When they're training a new staff, you can also do micro learning of the old staff as well. So you don't want to wait till the last minute. You want to train early and test often and review often, because again, life gets very busy. We forget, you have to modify one time and that becomes the norm, and it's different than the policy. And you want to make sure that your trainings match your policies that we just talked about also. We want to make learning accessible through small areas, like I mentioned, the micro courses, team huddles, staff meetings. It's always nice to do. One of the suggestions that I've made is come up with a yearly calendar of training topics, and during your staff meetings during that month is what you touch base on. Maybe it's just a review of policy and that you have in place, or a process that you have in place, and you can share some data about what you're measuring on that with your staff, because that reinforces that they're doing well, right? And reinforces what you want them to do to ensure that patient safety. Testing and feedback is another important area. And testing doesn't have to be formal testing where they're sitting down and creating that anxiety of taking a test, but it could just be having conversations with your staff of asking what happens if and what happens when, on that, to see where they're at. And the more you can talk about the processes and the systems, especially as they relate to any standards that you work with, the more comfortable your staff are discussing it, especially when the surveyors come either to your site or via video on that. So it's not really testing, it's just reinforcing their learning. And then you want to get feedback as well on your processes, your procedures from your staff that are implementing it, to make sure, A, are they implementing it as you wrote it? Or are there modifications that they need to make their job easier or make it a better experience for the patient? Or just, does it make sense that we have to go down 3 floors to get the medication and then come back up? Simple time management tasks, but give feedback on the processes and the trainings that you're having to see what your staff need. And again, that gets open communication, which makes it easier anytime they have someone coming into your facility to talk about what they do. So pillar number 4, documentation discipline. Documentation, document. If it's not documented, it didn't happen. Some of the few things that you need to remember with documentation is version control. Have a way of tracking what version of a policy is there, especially if you're printing out policies and having them on, let's say, the hospital floors or in different units or different clinics. If you have multiple clinics, you want to make sure that you are able to verify that you have the most recent documentation, such as a policy, that the staff can reference on that. Have an easy way of indexing and formatting. So it's easy reference, table of contents, is a simple way of doing that. Also looking at how you number or label your documents so that it's easy reference of going, oh, this one is an emergency room policy and procedure. Oh, this is for nursing and medication. This is a pharmacy policy and procedure, without having to read the entire policy procedure, or even documentation forms. On the bottom of your forms, put things like for pharmacy, put the abbreviation that you use for pharmacy all the time and a form number, so I or anyone can look at that form, look at that number and go, oh, this is for the pharmacy area on that. So it's easy to look at and reference on that piece. And when staff need to look at your policies, the index is a very important part, so they can look and quickly glance where they need to go for the review of that policy, rather than going through, one hospital I was at, they had like 10 huge binders of of policies, and there was no index. So you need to have something for easy reference, quick reference for your staff. And then make sure you have digital backups. If your policies aren't digital online, but you have digital backups, and that you have locked backups as well. Again, going towards that version control to make sure that you have the most recent items up to date. So these are some things that you need to keep in mind on that. And I can tell you, it didn't happen with a AAA account, but there was an accreditation for another organization that did not achieve accreditation because an outdated emergency policy was still being used. And in part of their hospital where the other part of the hospital had a different policy. So they weren't matching. So make sure that it's consistent throughout your organization. Pillar number 5, continuous monitoring. For those of us who like data and like to look at outcomes, this is a very fun one to do. This is a place where you're able to measure all the great work that your staff's doing, all the great experiences your patients have gone through, the outcomes of how well they're doing after their services. And with this, you can create some wonderful things, dashboards, so a board, and we'll kind of see this when we look at tools, but a quick reference of how well you're doing. And it gives feedback not only to the leaders, but also share it with your staff. So again, they know how well they're doing. Healthcare is a wonderful place to work, but sometimes people forget to say thank you, or you can't see the end result on that. And dashboards are a great way to see where they're doing well. And on the same hand, where you might need a little assistance or help with on that. So if you're tracking of how quickly someone is getting medication, or how quickly someone is coming in and being admitted to your organization, and you set a threshold of 3 minutes, your dashboard can be a live dashboard and go, okay, well, we're averaging 5 minutes. What do we need to do? It allows you to see something before it becomes a crisis so that you can address the matter. So again, these things aren't just for accreditation and get you through accreditation, but it's to make your whole system and process work better. Internal audits are an important factor on this. Run quarterly mock audits of what might happen, what are some of the questions. So this is also a great place to get your feedback. It can be this, micro testing as well, to see where your staff are, get them comfortable with answering questions, and an opportunity for you to guide them on how you want them to respond to questions on this piece as well. The mock surveys, great way. I just talked about that. The internal audits, great place. I want to jump back to that. Great place to do cross auditing. Have your nurses that work in the emergency room visit the floors and do an audit there, and vice versa, so that they see what each other is doing. They see how they all work together, and how paperwork flows, and how they use information. It's a great tool, not just for accreditation, but for your staff as well. And I can tell you with American Accreditation Association consultants that we have available, they often do mock audits. They will help guide and set up internal audits, as well as can help and create dashboards for you. So if you don't have the resources within your organization, there is assistance out there that can help you move towards those goals of accreditation. So a self-assessment. It's kind of scary looking at what you're going to do. What's your readiness? Having to look at yourself. So these are some of the things that you want to look at. You want to download and complete accreditation readiness scorecard. Most of the accreditations have this on that. If not, it's very simple to create one of your own. And you want to rate yourself on your leadership engagement, where are you at that? Are all the leaders on the same page? Are they truly sharing that excitement for accreditation with their staff? The policy quality, where are you at with this? And make sure you take a hard look. Don't be overcritical, but don't go, oh, of course I have that. You want to really look at your policies and go, are they indexed? Are they easy to read? Are they actually what we do with the patients? And where you are with your staff competency, and documentation readiness. And I will share that a recent survey that I did, while the staff were getting trainings, it wasn't being documented. So we had to get a corrective action on that to help them make sure that it's documented. So remember, if it's not documented, it didn't happen. So if you're training staff, have the staff sign in, do a pre-post test on formal trainings and quizzes, things like that. And you want to look at your monitoring and feedback loops, see where you are. You know, you want to see what's your highest score area, celebrate that. And where do you need to improve the most? And this will help you create a project management guide on those parts. You know, just remember, no matter what your score, remember readiness is a journey. It's not a destination. I always say we work in healthcare, and because we work with humans, our every day is changing. So once we get used to one policy, we find out, oh, there's more technology, or there's another requirement, or this wasn't really working. We need to modify it. So it's constantly being modified. And that's not a bad thing, because we're constantly moving and trying to make that journey to a better experience for the patient, better experience for our staff, and better outcomes on that. So some of the common pitfalls or areas that hit you hard, get you flustered, feel like you're not going to make it, are kind of listed here. And we'll go over these, but I do want to say there are solutions to these. Identifying the pitfalls is the first step to creating a solution so that you can make it a pleasant experience. So common ones are one-time project mindset. For accreditation is ongoing. From the time you decide that you're going to go for accreditation, determine which accreditation you're going to seek, preparing for that, having the survey, it doesn't stop there. Formally with American Accreditation Association, and once you get your 3-year certification, we ask for certain documents and updates at the 18-month mark. And that is looking at what's happened in the 18 months since we were there. So it is ongoing. It's not a one-time thing. So the excitement about accreditation, the mindset the leaders need to have, and your staff is accreditation is now our way of life. These standards, they're ingrained into our systems and our processes, and it's just making us better. So it's ongoing. Another common pitfall is low staff engagement. I've seen where hospitals have identified a few people, okay, your job is to make sure that we're ready for accreditation, and that's it. It really takes your entire team for accreditation. And as I mentioned, talking about accreditation, asking all your staff about the questions and having those open conversations makes it much easier and gets the staff all engaged as well on that, which makes it a more pleasant experience and ensures that all your standards and policies are being put in place. The last minute panic, I can't say that you won't have that, because even when I've done accreditations for organizations, it's the anxiety of somebody coming in and looking at things, even though you know and you believe that it's perfect. They're coming up with a different view. So they're going to share some observations, but don't panic about that. What we pride ourselves at American Accreditation Association is that we really meet the hospitals and clinics where they're at, versus some organizations that are very rigid. We do understand that treatment and care in the US is very different than treatment and care in Egypt or anywhere else. So we look at what is happening in your organization, what are the possibilities, and have conversations about that. So we I personally say that AAA is more of a concierge accreditation provider, that we are working with you to help you, and we want to partner with you so that you're successful at this. And then the other common pitfall is outdated tech reliance. And sometimes, that one is on here, but I've worked with hospitals and clinics that don't have a lot of tech in their organization, and that's okay. I will share. I'm several decades working in healthcare, and worked in healthcare before. Electronic health records, so paper and pen, have been in that field, and that's okay as well. What you want to make sure is that any data, any tech that you're using is measuring and sharing and reporting accurately on that. So what are some of the smart solutions? Talked about the continuous improvement mindset, that every day we're going to make it a little bit better. We're always looking at how we can make it better. Not necessarily just to change things, but really take a look at, oh, can this be improved on, right? It's ongoing quality improvement, I think, is maybe a better thing that I should have wrote here, because it's about improving the quality, patient care, staff engagement, staff involvement, leadership engagement as well. Another one is embedded roles and KPIs. So key performance indicators, knowing what you're measuring, what are your thresholds for those measurements? It's okay to say not everything's going to be 100%. I will just say that out loud on that piece. And to embed roles into your hospital staff. So who do you have in your nursing besides your director of nursing? Is there another person in the nursing department that can help you with the standards and monitoring, and just being on task of talking about the standards and keeping a task on what could be improved, where we are with our KPIs on that? And then regular mini surveys are a nice one to look at. And really, you almost do this already, or probably do this already, when you're doing like chart audits. That's looking at your documentation, looking at any peer reviews when you have doctors reviewing other doctors' notes. That's another way that you're already doing mini surveys. Is it matching the standards that you have written in your procedures on that piece? So that's very important on that part. Digital tools, are there things that you can do that make it automatic? Is your hospital system equipped with electronic health records and electronic systems that you can make those dashboards that we were talking about automatic, and that can lead to action plans and create guide your performance improvement? So then we go back up to the top again on that. So how are we doing for time? 8:34. Okay. So global case studies, a couple that I've done on this and been part of, is in Egypt, AAA accreditation via task force. An organization was fragmented documentation. They had documentation, different formats, different ways of writing, looking at that. So they implemented a task force and started looking at weekly audits to look at their documentation and identify areas that they need to improve, who needed to be involved, what were ways to improve it to meet standards. They also looked at, if we change the documentation, how do we change our process? So their policies as well. And that organization passed with 97% compliance on that part. So yay, if you see me, I'd be cheering. Another case study that I became aware of was in the Philippines. Organization started using QR code tracking. They were working out in the community, and there was low documentation from those individual the staff that were in the rural areas. So they then started they utilized some technology, created QR codes to help with tracking, and they also used picture forms to help easy with the documentation on that. And so that compliance improved without adding any additional administration or staff burden. And it actually became much easier to track as well. So they were able to identify any gaps in their documentation almost instantaneously, so within 24 hours versus when they were doing chart audits and reviews like once a month. So that put them in compliance. Another one of my friends works at a mental health organization, and one of the challenges was all the surveys people were getting, both for the staff as well as the patients, and staff having to ask their patients for the surveys. And the solution was, it was looked at what surveys were needed, how they could combine the surveys into one survey, because they were being asked by the government, by a funder, by their own several departments in their own organization to do surveys. So at one point, a patient was had like 10 surveys within their treatment stay, which is a lot of that. So then they reviewed what was being measured, what needs strategically need to be measured, and with that, they were able to take it down to 2 surveys, a survey at the front end and a survey at the end of their services. And that really helped with staff morale as well as patients morale and patients adherence. Many patients stopped coming in as they were kept getting surveys, so that the patients remained in services, which is always good. And that was just a reminder that compliance is not about having the most resources or the most information in minute detail, but doing it, making use to what you already have, what you already collect, and doing it in a smart manner on that. And those were some things that through accreditation, either the site surveys or consultants working with the organization prior to the survey came up with to help them and move them through achieving surveys. So we've talked about some of the tools that we need. Remember, and I'm just going to review a few here. I'm not going to go into great detail on this. If you need more detail on this, reach out to James, and his team will be able to work with you and the consultants to get this in order. But looking at data is very important for you as an organization. We look at data from the accreditation side of what are you measuring, but also what are you doing with those measurements? Are you just collecting data and it's sitting in a database, or they're paper forms of surveys that you haven't looked at to measure on that? So you want to look at that. Some easy things you can do with data is a Gantt chart on this, just seeing the timeline of what's happening. This can also be a wonderful, I'm going to show you a screen here of, this is a wonderful tool for you to use when you're going through accreditation. So what's the expectation? What's the timeline? And this is out of Canva, but there's similar things that you can do. Excel creates one, Word creates one on this, but you can measure and really project manage out your accreditation process and preparing for the accreditation and making sure that you're addressing everything that you need to address. This will take care of some of the anxiety. It hopefully will take care of the last minute pitfalls that we were talking about. But what are you going to do in January, week 1, week 2, and here, and you can get really detailed in this of who's doing what's achieving, what are the goals on this. But this is a good way of seeing what's the plan of having that visual representation across the timeline. It's really the most common use in project management, so many of you are probably familiar with it on this. So I won't go into too much detail on that. I could talk forever on those. The next one is staff tracker. How are we doing with the staff on this? Who's working on what? So you can keep them held accountable. Is one way of doing it when you're preparing for accreditation, when you have different departments, who's going to be taking this and where are they at? Is it done? Are they working at it? Do they need help with that? You can also do a staff tracker on preparing your staff and having conversations or things you want to do with your line staff, like a mock audit, tracking who's participated in a mock audit. This is also a project tracker can be a great way of tracking who's done trainings and who still needs those trainings on that. So this is another way to do it, to add your person and be very specific on that. And this is nice because it helps the project managers understand where everyone is at a quick brief. Let leadership know what's happening, where do resources need to go, and bring the team together to find solutions on anything that is overdue or people are stuck or having challenges with on that piece. And it's a great way to provide feedback to the team. Look at all that we've done so far. We have a lot. Well, this one that's on your screen, no, only a couple more things that need to be completed. And it looks like one person identifying key resources is stuck. So let's take a moment to talk about that. So this is another great way of doing this. And I find that it helps alleviate any anxiety of all the moving pieces of achieving accreditation. Another one I mentioned before is a crosswalk. So here we have very simple one that we put in place, but it can be complex as well, as I mentioned before, but let's talk about this one. So here we're, looking at gap analysis, crosswalk, identifying discrepancies between the existing policies, procedures, and practices and the desired standards or best practice. This really helps pinpoint areas for improvement and enhance patient care, ensure compliance, and ultimately increase efficiency. So comparing, what do you have in place now? Is it compliant? Do you need anything on that? That's a simple one. You can add more columns of, is it for accreditation for AAA? Is it for my licensure requirement in the state of Florida? Is it a requirement for a grant that I have or any funding that I have? So you can add that and have it all in one place, which is nice. I even take it a step further and I have another column where it has the requirement, and then I have a hyperlink to the document if it's appropriate for documentation, such as a policy. I have a hyperlink to that policy, so it's easy reference of this is what we're saying, what we say supports this standard or regulation on that. So yeah, these crosswalks are wonderful, and it has helped me immensely. You can do these very easily in Word, or I often use Excel on that. So we really provides valuable insight of where you're at and what you need to continue to do on that. Come on, dear computer, thank you. And then lastly, we have one of the tools is the executive briefing slides, which is very important. Again, something that you'll probably show at the beginning when you choose that you want to go after accreditation. Why do you want to do this? To show and get your leadership all on board so you have all the information together. And what this is a very high level presentation designed to inform and engage leadership, including board members, your chief C-suites, so CEO, COO, the executive, senior management, about the important scope and strategic implementation implications, sorry about that, of healthcare accreditation. So the purpose of the briefing, provide the decision makers. So these are all the people that are going to support and help get you prepared, continue to be moving towards accreditation and process improvement, with the context and information that they need, understand what's the value of accreditation, why do we need to do this on that. What's the importance of accreditation? Are we doing it simply for the prestige? Are we doing it for funding? Is it required by our country's laws and regulations? And then align accreditation efforts with organizational strategy. So what are we saying as an organization? And with healthcare, we know it's about patient care. And that's really what we're looking at with healthcare accreditation. We want to support quality care, patient care on that. So if they don't align, make sure you give us a call, because standards should align with most healthcares, if not all. Make informed decisions about resources, allocations, timelines, and compliance priorities, and having a conversation about reality. So to avoid that last minute, that pitfall of preparing last minute, give yourself time to to make sure that everything's in place for your accreditation. Don't decide today is April 11th. We want to be accredited by May 1st. Don't set yourself up for failure. Having talks, and that's what this executive briefing is all about being realistic. What are the resources that need to be allocated? Your staff might be working at 100% right now. And so how are they going to add on preparing for accreditation? The nice thing about that, the consultants that you can hire to prepare you, to do mock surveys, to get those things in order without putting overdue stress on your already wonderful staff that's helping and focusing on patient care. That's a big part as well. And then promoting a culture of quality, accountability, and continuous improvement is very important on this. So the briefing may also include the benefits. So looking at it, I talk a lot about quality and care, but it also can impact your funding. And potential for expanding into other areas. Accreditation also looks at trends in industry shifts such as telehealth, integration into accreditation models now. Medical tourism is a big one as well. And this accreditation then becomes a competitive differentiator for you, to show that you've gone above and beyond and you want to ensure the quality of care that you're providing on that. We've talked about cost benefit analysis, resource needs, but looking also at the risk of non-accreditation is important to debrief your executives on as well, and acknowledging that their engagement, the staff readiness, creating an action plan or recommendations are an important part. And during the executive debriefing, a question and answer discussion or an alignment, might be what you want to call it, is an important process to have to ensure that everyone's on the same page, that we're all thinking alike, and identifying any barriers, concerns. So it's very important to be open, honest, and sharing that information on there.
Yeah, thank you, Dima. Thank you, Wendy, for this wonderful webinar that is very, very beneficial for all of us. And thank you all the attendees for attending today. But the last thing here is that if you are really interested in applying for the accreditation for your healthcare facility, you can just email us here at info@AAA-accreditation.org, or you can just drop your email right now in the chat, and some of our business development team will be giving you a very quick call for a free consultation call regarding the accreditation process and how much time that will be taking. for all of us, we all know the importance of the accreditation for our healthcare facilities. So let's take the step further here and start your accreditation right now for the facilities you are managing right now. So see you again in many different webinars, and see you in the training this month. And thank you for attending today.